Hello, everybody. This is Mike Rochelle with Cloudix. I'm here joined with our CEO, Shiva Nagalingam, and we're going to be talking today about Cloudix and our MediGuru platform. Here at Cloudix, we've been in business since 2009, and we really are a systems integrator, primarily focusing on the Azure cloud. We are a Microsoft Gold partner for cloud. And we have considerable amount of experience in the healthcare space with LivaNova, Vera, Kaiser Permanente, and MediGuru, who we're here to talk about today. So MediGuru is our telemedicine practice where we actually enable you to enable your telemedicine dream. The platform has actually been live. We created MediGuru several years ago. It is cloud-based on Azure, and we use it as an accelerator to accelerate your intellectual property into an actual application. Historically, we had an app in India and later in Arizona. So Shiva, can you tell us a little bit about your dream and how you brought it to place?
Very good. Thanks, Mike. So a little bit of history lesson as far as the origin of MediGuru and the genesis of how it became Cloudix or a platform inside Cloudix. Late 2014, we were vacationing in Cambodia, Angkor Wat, and in Angkor Wat, apart from the resorts and the historical sites, there isn't much to do. So if you get out of the resorts, there is abject poverty. And one of those days when we were driving through the streets, we found this long line of people who were waiting to get treated. Sometimes they were waiting for a couple of days. They were all camped outside with kids, and they were waiting to get into this small little white building, which was the biggest government hospital in Cambodia at that point in time. We realized that, we saw that, and we realized that something has to change. So we came up with this idea about a virtual kiosk. So me and my wife, both being engineers, during the breaks, we used to sort of write this architecture on napkins, and we used to dream about how to bring a solution to the market. One thing led to the other, where from a virtual kiosk, we went into a platform which would be more of a telehealth practice. And the need of the hour was, we saw there was a lot of stigma around mental health issues in India. So we launched an app which was serving patients with mental health issues in India. And then later on, when we were talking to people and advisors in the US, we figured out there is a need for such a platform for businesses to onboard a telehealth practice. And MediGuru was forked out as a platform as part of Cloudix to take advantage of that. So if you look at what MediGuru does, MediGuru as a platform enables a couple of things. One is telemedicine, and the other is live engagements. The difference between telemedicine and live engagement is, telemedicine is the concept of you as a provider talking to a patient virtually. So this could be either through a phone call, it could be through chats, it could be through a video call, and so forth. And there are enough components around it. So details about who the provider is, what I'm talking to the provider, a secure manner of having this conversation, which is HIPAA compliant, as well as some level of calendaring and scheduling, and then a little bit of billing information as well, so that the provider gets compensated for the conversation they are having with the patient. From a live engagement perspective, this is more about how do you keep up to date with your patient. So whether you get alerts or notifications from the patient when they're asking a question to you, or you can do a live chat with the patient, as well as information about their medical history, files and other data which is being exchanged between you and the patient, and which you can collaborate with other providers as well. All of this is possible through the MediGuru platform. And through the MediGuru platform, there are a couple of things which you can do. One is, if you already have material which you're exchanging with your patients or giving them updates, for example, in this COVID environment, you might have articles about how to take care and how to stay safe. All of that can be put together inside the workflow of what MediGuru platform allows you to do, so that you can have the single message which is transmitted to all your constituents. But the main meat of what MediGuru provides you is the telehealth practice, which is you as a provider having the capacity to talk to your constituents, which are the patients, about their health issues through either a chat medium or in-person chats, or through a virtual discussion, which is a video chat. And all of this can be stored into your EMRs, existing EMRs and EHRs without any change in the system. And this is all built on top of Microsoft Azure in a very secure manner and HIPAA compliant.
Very good. So our basic patient and provider telemedicine app offer, it has a COVID-19 CDC self-diagnosis app at the very beginning so that people can self-screen. And it has that video conferencing capability that Shiva talked about, where we have the basic patient and provider application. What we'll provide to you is the onboarding, location setup, your logo and colorization. And then we'll train you how to use it and how to help your customer or your patients to use it as well. And we'll provide 3 months of usage for free. If there are any customizations or integrations that are necessary, obviously that would be something that we would have to do after we get the free app up and running. But we hope to be able to do this very quickly for you, especially in the situation that we're in with COVID-19 now. So Sheila, can you kind of walk us through how this is going to work?
Perfect, I will do that. So the way we are going to have the free app is, it is pretty straightforward and easy to use so that your patients can come over and register because you really want a live patient to talk to you. And they can initiate a video conversation with you. There is a lot of customizations built into it, and most of the customization is around the branding, your logo, the look and feel of like how the app is, so that your patients have a feeling of having a conversation with you as compared to being in a different site. The registration itself is pretty straightforward: first name, last name, email address, and the location. And as long as we have validated their email, they are registered in order to have a conversation with you. So once they log in, the first thing which they'll get to do is, obviously we have a link to the CDC COVID-19 self-checker. And this is a list of simulated questions which allows the patient to figure out whether they are exhibiting the symptoms, and because of those symptoms, if they want to have a conversation with you. You as a provider can also customize the test. So if there are something in addition to the COVID-19 you would like for your patients to look at, you can customize them as well. Once they have gone through the self-checker, the next portion is, or pretty much everybody wants to have a virtual conversation now. Nobody is coming into the office. So a list of providers who are free at this point in time and who can do a video conversation, they are provided to the user. With a single click, they can have a conversation with you, and this could be through a video chat. The video chats are typically for 15 minutes, 30 minutes, or of the duration of your choice. They can also chat with you during this conversation, where they can exchange information, or you can exchange information with the patient. From a provider perspective, you can also look at all the conversations you have had with your patients, as well as any of the conversations which are being done through video. You have the option of having it video recorded. This will be an added-on opportunity which we provide to you as part of the customizations. Now, the patients themselves, like, I mean, they can also schedule a video call with you. For example, if suppose I'm doing it for one of my relatives or one of my kids, then I would go ahead and schedule it at a convenient time, and a list of appointments which are available from the providers are visible to them. At the time of the appointment, it comes to the calendar, and they would do a single click, and once again the same conversation happens, similar to like how they would have done before, either through a video chat or through a text message.
Very good. So it's very powerful, this small little app. We do have a free 3-month trial offer available for you. So if you'd like to talk to Shiva or myself, you'll be able to get contact information after the video. Thanks. Hope you have a great day.
Thank you.